Administering nebulized medication. For this procedure, you will need the medication record, a nebulizer set and the medication, or a prepackaged nebulized medication and applicator, saline, an air compressor or wall air or wall oxygen, a metered dose inhaler, and an aero chamber if appropriate. You may also need a cup, an emesis basin, tissues, some warm water or saline to rinse the mouth after treatment, exam gloves, and goggles and mask if the client is coughing or sneezing. Gather the necessary equipment. Select the ordered respiratory drug. Check the liquid respiratory medication for discoloration and check the expiration date on medications. Check the respiratory medication against the client's medication record and calculate the drug dosage if needed. Check to see if the respiratory medication is pre-mixed in saline or if you will need to add a prescribed amount of saline to the nebulizer. Check to make sure you have the 5 rights: right client, right medication, right dose, right route, and right time. Check the client's chart for drug allergies and hypersensitivity. Proceed to the client's room and provide for privacy. Verify the client's identity, then explain the therapeutic purpose of the medication. Position the client in an upright position for better expansion of the lungs. Assess the client as appropriate. Wash your hands before setting up the nebulizer. Verify the medication the 3rd time and then prepare it for administration. Attach the tubing to the bottom of the nebulizer cup and attach the other end to the air compressor or wall air. Look at the medication at eye level if using a dropper to dispense the solution into the nebulizer. Determine the correct amount of medicine and pour the entire amount into the nebulizer cup carefully so you avoid touching the drug. To prevent spillage, cover the cup with the cap and fasten it. Fasten the T-piece to the top of the cap. Always avoid touching the nebulizer mouthpiece or the interior part of the mask. Before turning it on, adjust to 6 liters per minute or less per the physician's orders. This drives the medication into a mist or wet aerosol form. Administer the entire dose of medication. This usually takes about 10 minutes. The medication is completely administered when there is no more mist being produced. Instruct the client to breathe in and out slowly and deeply through the mouthpiece or mask. The client's lips should be sealed tightly around the mouthpiece. Remain with the client long enough to observe the proper inhalation-exhalation technique. Also, observe the client for any side effects or distress while the medication is being administered. When the nebulizer cup is empty, turn off the compressor or wall air to stop the aerosolization. Detach the tubing from the compressor and the nebulizer cup to prepare all the components for cleaning or disposal. If the nebulizer is disposable, dispose of it in the appropriate container. If the nebulizer will be reused for this client, follow your institution's policy regarding the cleaning and storage of the nebulizer components. Assess the client immediately following the treatment for results or adverse effects from the treatment. After the treatment, offer the client a mouth rinse with warm water or saline. Reassess the client 5 to 10 minutes following the treatment, as some effects may be delayed. Dispose of your gloves and mask, if used, and wash your hands. Record the medications administered on the medication record and record the assessment data. Metered dose inhalers. When using metered dose inhalers, provide for privacy and verify the client's identity. Explain the purpose of the medication. Then wash your hands and don gloves before administering the medication. Verify the medication against the client's medication record. Place the inhaler into the applicator and then place the aero chamber onto the inhaler if it is needed. Shake the pre-packaged inhaler to thoroughly mix the medication before each inhalation of medication. For example, if the client is prescribed 3 puffs, you would shake the nebulizer 3 times. Instruct the client to exhale deeply before using the inhaler. Next, have the client place the mouthpiece in his or her mouth and close the lips tightly around the mouthpiece. Instruct the client to press down firmly and steadily on the metered canister to dispense the medication into the chamber while simultaneously breathing in slowly and deeply to inhale the medication. Have the client try to hold the breath for 10 seconds if able, then remove the inhaler to slowly exhale. If the client is supposed to take more than one puff of the inhaler, have the client wait at least 60 seconds between each prescribed puff of medication. After the treatment, offer the client a mouth rinse with warm water or saline. Observe the client for several minutes to assess for any possible adverse effects from the medication. Inhaler medication is delivered into the bloodstream almost immediately, and reactions can occur very quickly. Remove your gloves and wash your hands. Record the medication administration and your observations.